How do you help patients in a medical fight?
My role as a paediatrician or senior medical officer is to look after the health and well-being of not only the patients but their families.
I'm the nurse unit manager of the Paediatric Critical Care Unit, just providing some compassion at probably a family's worst day of their life sometimes, just being the hand to hold, the shoulder to cry on, as well as providing that expert medical care.
I'm a member of the Allied Health Cancer Care team, and I help patients each day for the weeks and months of their treatment, helping them stay physically strong or mentally strong as they endure the rigours of their individual cancer care. What is the biggest challenge in your role?
There's multiple challenges. People will often say, how do you do paediatrics? Well, it's such a rewarding job in itself, dealing with little people. They are amazing. They want to get better. They don't dwell on being unwell, and the first sign of they starting to get better is when the room feels too small and they want to try and escape.
I think the biggest challenge is dealing with unwell children who may be unable to communicate with us, where we're trying to really look after them with anxious parents. So we have to work as a team.
How does that challenge make you feel? I guess the actually makes us feel quite proud that we can provide this service on the coast. We've had over, I think it's close to 1,500 admissions that would have otherwise had to have gone to Brisbane.
The emotional roller coaster of the work that we do and the personal nature of the care that we provide people. So sometimes at the end of the day you can feel quite exhausted, but generally most healthcare workers do healthcare for the fact that they want to serve the community and help people. And there's an element of, if I was in that position, how would I like to be treated? So the job is quite satisfying and quite rewarding in that regard.
How has Wishlist supported you? Wishlist has been part of my career for as long as I've been a paediatrician, and has contributed in so many ways, helping children to feel less anxious or to be supported. We've had the clown doctors funded by Wishlist, which has been an incredible service, and we're so appreciative of them. They support us as clinicians as well and make us have a giggle. My research project recently, where we were trying to do quality improvements for the care of complex children with rare diseases, and it's been life-changing, and I was only reflecting this morning on how the landscape has changed because of the Wishlist funding that we've received for our projects.
They set up a paediatric retrieval transport unit. They have provided us with parent accommodation, which has been invaluable for families that have come from out of region to be able to stay close to their babies. They've decorated our unit, and they've provided us with education funding as well.
Most people are just incredibly grateful for the support that Wishlist provide them and their families. Wishlist step in and support them through accommodation, and that allows them to reduce the fatigue of travel, that allows them to reduce the cost burden associated with travel. It also allows them to do better during treatment, physically and emotionally.
What would you like to say to the people who have donated to Wishlist? From the bottom of my heart, thank you. It really does make a difference to our families.
Every little amount that is contributed counts towards these amazing facilities and the research grants that are available to us twice a year to do those special projects that we think will improve the quality of life for children.
A big thank you to those who are donating, whether they be a large organisation or small individuals. So thank you.
Thank you.
Beautiful.
Yeah, very polished.
Oh no, it's just trying to keep calm and carry on.
I couldn't find the words.
It's a pleasure. Happy to help Wishlist in any way we can.
Thank you very much.
Thanks guys.